Good morning. I'm Professor Michelle Haber, Executive Director of Children's Cancer Institute. The last few weeks dealing with the impact of the COVID-19 virus have been incredibly challenging for all of us here at the Institute, as I'm certain it has been for so many of you. We've all had to adapt to completely new ways of living and working. And right now, like many of you, I'm completely isolated at home, but thankfully managing to ensure the safety and continuity of the Institute by virtual meetings here from my home office. I must say, though, that it has been just so reassuring and heartwarming to hear from so many of you who are in a similar position through this unprecedented situation. And it does give me such encouragement to know how people are really pulling together in this crisis. As many of you know, we have an extremely close relationship with the clinicians at the Kids Cancer Centre at Sydney Children's Hospital in Randwick, as a number of the clinicians there are also our research leaders at the Institute. And in addition to our Randwick colleagues, we also collaborate with all the children's hospitals around the country in undertaking research on a national scale that supports kids with cancer around the country. I do just want to take this opportunity to acknowledge the extraordinary work of our clinical colleagues in the health community, not only now through this COVID crisis, where the pressures on their teams are even greater than usual, but also all year round treating the kids with cancer, because it is only by working closely with our clinical colleagues that together we can continue to impact the future for these kids, and together we can work towards one day curing all of these children with cancer. Like many workplaces, our institute has undergone a significant upheaval as a result of the COVID-19 pandemic. But that does not mean that our research has stopped. To the contrary, here at Children's Cancer Institute, we have innovated our processes and we are using the best technology to continue our research and to move forward with the collaborations that will one day help us cure all children of cancer. Our determination to continue this exceptionally important work at this time is unwavering. And quite frankly, that is simply because we cannot stop. There are still 20 children every week around the country being diagnosed with cancer, and too many of these children are still dying of their disease. We must continue to make the discoveries that have the capability of contributing to our goal, that goal that we cannot shift from, of one day curing all children with cancer. Right now, many of our scientists are having to work from home, but they are continuing to be extremely productive, analyzing the data from their recent experiments and writing up their results and their findings into the scientific papers and journal articles that are capturing the evidence for potential new cures and treatment, and when published will result in their findings being shared with the world. We also have a small dedicated team of our scientists who are continuing to work in our labs on a daily basis, focusing on patient-facing diagnostic programs that are critical in identifying the best treatments for children being treated with cancer today. Programs like our minimum residual disease program to identify children with acute leukemia who are at highest risk of treatment failure so that their treatment can be intensified to give them the greatest chances of survival. And programs like our Zero Childhood Cancer program, which is identifying personalized treatments for children with high-risk cancer from around the country based on the biology and genetics of each individual child's cancer. These programs are saving the lives of children who are fighting cancer right now. And as such, these programs simply have to continue. Cancer does not stop, and I assure you, neither will we. But as you can imagine, the current crisis has had a devastating effect on our fundraising. Many of the events we rely on to fund these important research programs simply can't go ahead in the coming months because of COVID and the social distancing rules it has brought in its wake. And so a large number of these events have simply had to be cancelled. So right now, we need your support more than ever to continue this critical research. And so if you can, please donate today. Your passion and your commitment have always inspired me and our staff to continue our important work, no matter how hard it is to do that. And I know now more than ever that you will be behind us. I am absolutely confident that we will emerge from this crisis stronger, more resilient, and more focused than ever on achieving our aim of one day curing all children with cancer. And from all of us at Children's Cancer Institute, I want to say, stay safe, take care, and thank you so much for your continued support.